There is a large number of people that care for pet cats around the world, and with increasing quality of care and medicine, cats can now grow to be quite old. While kittens are cute and fun, prospective and current cat owners should be prepared for the health problems that come with old age, one of them being feline cognitive dysfunction syndrome. Cognitive dysfunction syndrome is a degenerative cognitive disease that is somewhat similar to Alzheimer's disease in humans. It affects a large number of senior cats, with some studies reporting around a third of cats over the age of 11 could be diagnosed. Diagnosis becomes increasingly more likely as the cat ages, especially once past the age of 15. Cognitive dysfunction syndrome can affect both dogs and cats, but there's still much to learn about the feline counterpart of this disease. Currently, the acronym VISHDAL is used to describe behavioral problems that indicate a cat may have cognitive dysfunction. It stands for excessive vocalization, changes in interactions with other pets or people, changes in the cat's sleep-wake cycle, house soiling, disorientation, changes in activity levels, anxiety, and learning and memory. However, these behavioral issues can also be indicative of other issues. They may also sometimes be ignored by owners as thought to be simply natural changes due to aging. A cat may also have more than one health issue, which may make cognitive dysfunction syndrome especially difficult to diagnose. It's important for the health of the cat to work with and visit veterinarians to be able to rule out the possibility of other issues and diagnose cognitive dysfunction syndrome. These behavior problems can make life both uncomfortable for the cat and for the owner, and cause issues within the household. A cat excessively meowing at night and going to the bathroom outside the litter box will not be met with joy by the owner. Equally bad, a cat getting disoriented, confused, and having its sleep cycles messed with will likely feel anxious, and the condition will decrease its overall welfare. In severe cases, these issues may even result in the cat's euthanasia. Because of this, it's important for cat owners to understand the possibility their cat will eventually experience such cognitive decline and know of preventative measures and treatments. Not too much is known about the causes of this disease. However, a survey did find a link between cats living in more rural environments and a lower likelihood of developing cognitive dysfunction. It's thought this may have to do with air quality, but further research needs to be done to make that correlation. Including enrichment and mental stimulation for one's cat is a good preventative measure. By having cats do activities that encourage thinking and play, owners can strengthen their cat's cognition. Being good for the cat's health overall, it is also a good way to help prevent the cat developing cognitive dysfunction later in life. There are several brain changes that are thought to be associated with feline cognitive dysfunction: loss of neurons, degeneration of axons, shortening of dendrites, and plaque-like deposits of anti-beta amyloid in the brain, along with other such changes in the brain and even the vascular system, are thought to be responsible for some of the behavioral changes observed in feline cognitive dysfunction syndrome. Unfortunately, this disease cannot be cured, so treatment aims to slow degeneration, relieve some behavioral problems, and perhaps strengthen cognition. Cats are not fond of change in general, and elderly cats with cognitive dysfunction are more susceptible to changes in their environment. Because of this, it's recommended to try to avoid making drastic changes, and if they need to be done, to do so slowly. Depending on the severity of the cat's condition, adapting the environment by increasing the number of litter boxes or even limiting the space available to them may help them have better control in their environment. Making sure the cat's diet is right may additionally help. Feeding the cat foods designed for mature cats and including antioxidants, vitamins C, E, and B12, omega-3 fatty acids, and things such as fish oil may help maintain health. Drugs have been developed for canine cognitive dysfunction syndrome, but some medications that work for dogs may be dangerous for cats. Because of this, it's important to seek advice from a veterinarian on potentially helpful medication. Overall, cognitive decline is likely for many cats as they age, and is something cat owners should be prepared for. There is still much to learn about feline cognitive dysfunction syndrome. Continuing research is needed to better understand this disease, and who knows, it may help people as well. Due to its similarities to Alzheimer's disease, it is thought that studying cognitive dysfunction syndrome in cats may provide a useful model for the human disease. Because of this, further research into feline cognitive dysfunction syndrome may not only help the welfare of cats that struggle with the disease and the owners that care for them, but may potentially also offer some information that could be useful for human health.